into Ebola and AIDS, first ever recorded Ebola epidemic that same year, Peter Piot became a pioneering researcher into AIDS. He has held key positions in the United Nations and World Health Organization involving AIDS research and management. He is currently director of the London School of Hygiene and Tropical Medicine. Peter Piot is connected with us today through the same Interaxio system that we use for our daily midday briefing. So I ask for your patience in terms of the technicalities of the use of the system. We have today interpretation from and into French, English, German, Spanish, Italian, Polish, Greek, Latvian, Dutch, and Danish, as well as international sign language. President von der Leyen will first make a statement, followed by Professor Piot. We will then move to the Q&A session. We will focus first and foremost on questions on today's package. And I can already announce to you today that the President will be back in the press room on the 1st of December for a further press conference after 1 year of mandate. President von der Leyen, you have the floor.
Vielen Dank für diese Gelegenheit. Die Corona-Lage ist sehr ernst. Sie ist in fast allen Mitgliedstaaten besorgniserregend. Sämtliche Daten unserer Gesundheitsagentur ECDC deuten auf eine sehr starke Ausbreitung des Virus in ganz Europa hin. Wir sind tief in der zweiten Welle. Immer mehr Menschen stecken sich an. Alleine in der vergangenen Woche belief sich die Gesamtzahl der bestätigten Fälle in Europa auf 1,1 Millionen. Und je mehr Menschen infiziert sind, desto mehr werden auch ins Krankenhaus eingeliefert. Wir erwarten, dass diese Zahlen in den nächsten 2 bis 3 Wochen weiter ansteigen werden, und zwar rapide. Im Augenblick liegt die Auslastung von Intensivstationen im europäischen Durchschnitt etwa bei einem Drittel des Höchststandes im Frühjahr. Es ist aber absehbar, dass sie mit den zunehmenden Infektionen und mit dem Einsetzen der Wintergrippesaison ebenfalls weiter steigen wird. Und im Vergleich zum Frühjahr fällt auf, dass diesmal kein Mitgliedstaat verschont bleibt. Die Länder Mittel- und Osteuropas zum Beispiel sind nun ebenfalls sehr stark betroffen. Wir haben es diesmal mit 2 Feinden zu tun, dem Coronavirus selber und einer Corona-Fatigue, also einer zunehmenden Müdigkeit, was die Vorsichtsmaßnahmen gegen Corona angeht. Und ich verstehe, dass die Menschen dieses Virus leid sind. Wir bringen alle seit Monaten Opfer. Und mich beeindruckt, was die Menschen über eine so lange Zeit in Kauf nehmen. Sie zahlen einen hohen Preis, sozial und wirtschaftlich. Viele Menschen leiden auch seelisch sehr stark unter den anhaltenden Einschränkungen ihrer persönlichen Freiheit und natürlich auch unter der sozialen Isolation, die wir alle erleben. Aber es ist jetzt nicht die Zeit, locker zu lassen. Die Situation ist zwar sehr ernst, aber wir haben es immer noch in der Hand, die Ausbreitung des Virus einzudämmen, wenn alle ihren Teil der Verantwortung übernehmen. Das heißt, die Verantwortung muss von allen und auf allen Ebenen übernommen werden. Auf regionaler und lokaler Ebene, in den Mitgliedstaaten und durch die Europäische Union. Wir müssen das Virus eindämmen, bis wir einen Impfstoff und bessere Mittel an der Hand haben, um die Gesundheit aller zu schützen. This means that everyone can and everyone must contribute. What we are expected to do is simple. We need to wear masks and stick to hand hygiene. And we need to avoid the 3 C's: crowds, close contacts, and closed spaces with poor ventilation. And only by protecting ourselves and each other, we can reduce the spread of the virus and thus reduce the impact on our lives and our livelihoods. Mais maintenant, nous sommes mieux préparés qu'au printemps. Les soignants, par exemple, connaissent mieux la maladie et comment soigner les patients. Les citoyens sont mieux informés. Et les gouvernements ont l'expertise et l'expérience du printemps. En juillet, la Commission européenne a demandé aux États membres de se préparer à l'arrivée de la deuxième vague. Et nous avons agi. Nous avons insisté pour que les États membres augmentent leur capacité de test. Et nous avons lancé un marché public conjoint de 150 millions d'euros pour faire cela. Nous avons créé un portail européen pour permettre l'interopérabilité des applications de suivi Covid à travers l'Europe. Les apps allemandes, italiennes et irlandaises sont déjà connectées et 18 autres devraient se connecter en novembre, c'est-à-dire en tout. 23 États membres ont une application ou la développent. 52 millions de téléchargements ont déjà été faits et j'appelle à tous les citoyens à faire de même. Chaque utilisateur compte. Son succès dépend du nombre d'utilisateurs. We have remedied initial shortages of medical and other countermeasures through rescEU stockpiling and working with manufacturers. We initiated joint procurement for protective personal equipment, ventilators, and intensive care medicine. We insisted on lifting national export restrictions for critical supplies, and we suspended customs duties and VAT on such items. We set up green lanes to allow the proper functioning of the single market and transport. We introduced a coordinated approach to travel restrictions based on common color codes for risk zones. And we concluded so far 3 advanced purchase agreements for safe and effective vaccines so that they can be available to all member states at the same time on the same conditions. 3 others are now in the pipeline. Now, we must build on these foundations with additional measures. And taken together, the package we presented today enables a coordinated approach to data sharing, to testing, to medical and non-medical equipment, to travel, and to vaccination strategies. We are all in this together. No member state will safely emerge from the crisis until everyone does. And that is why you will hear us stress the need for cooperation, coordination, and solidarity. Tomorrow, the heads of state and government will meet virtually. The aim is better coordination. I will call for greater data sharing to the data platform with ECDC. This will help us to know, for example, where there is ICU capacity or cross-border patient care can be organized when needed. We will also set up a European platform of national science advisors to COVID in order to exchange and align the advice given to the different governments. We recommend effective and coordinated testing strategies in the package of today, and we recommend increasing capacity for testing. Rapid antigen tests are now coming to the market. These can play a significant role, but we will propose an EU approach to approval and use, because only then there will be mutual recognition of tests and of tests results. For our part, we are now mobilizing 100 million euros from the emergency support instrument to purchase rapid tests that we will then distribute to the member states. And we launch a joint procurement to make more available. We call on all member states to link up national apps to the European Gateway in November. We call on member states to participate in a speedy joint procurement of essential supplies, such as medical equipment for the vaccination. We are proposing today to extend for another 6 months the VAT exemptions for the purchase of vaccines and testing kits. And we call on member states to facilitate travel when necessary. So we ask to work together on an EU passenger locator form. We need to maintain for now restrictions on travelling to the EU, but today we encourage member states to make it easier for couples and for families, for example, to reunite. We also propose to extend the green lanes beyond road freight to rail, air and water. And finally, in line with our EU vaccination strategy of the 15th of October, we call on member states to prepare now national vaccination plans and to review them now at EU level. We need to be prepared for the arrival of the first vaccines. There's a lot to do. There are many, many issues to be considered for an effective vaccine deployment. Just think of what kind of infrastructure will be needed for the storage, for example, the cold chains that have to be established, or the question what groups of population should be vaccinated first. Here we already gave a recommendation, so we ask the member states to work with that. But there's one thing I will be very clear. We will not compromise on the safety of vaccines. There are many issues to be considered, so finally, let's not forget about our commitment to universal and fair access to COVID-19 vaccines for all. We need to continue the Team Europe approach to join leadership in the COVAX facility. The COVAX facility is a huge success. 184 countries have signed up so far. We all know no one will be safe until everyone is safe. Le coronavirus nous met à l'épreuve. Mais en travaillant ensemble, en coordonnant nos actions et en prenant nos responsabilités à tous les niveaux, nous pouvons combattre ce virus, nous pouvons protéger notre santé collective et nous pouvons ramener peu à peu nos économies et nos sociétés à bon port. Merci.
Thank you very much, President. I now pass the floor to Peter Piot.
Thank you very much, Madam President, and good afternoon, everybody. I can only stress what President von der Leyen just said. The situation is very serious, and it risks to get worse if we, if we don't take more urgent and drastic measures. But the future is really in our hands, and the numbers are really staggering. And let's never forget that it's about people. It's about real people. These, when we say that 1 million people are infected in the Union now, the deaths are rising also. Last week, about 1/3 more deaths than the week before, which means that about 1,000 Europeans die per day from COVID. And again, it's about real people. So more and more families are affected. It's not just something that is out there and is marginal. But the good news is also that mortality, so the risk of dying from COVID when you're hospitalized, has been reduced by about half as compared to the spring, because we've got more experience, and also there are some progress has been made in terms of treatment, although we don't have really a cure yet. But think of it. If in a country 500 or 1,000 people have to be admitted to a hospital because of COVID-19, that is as if an entire hospital was closed and shut down for other people who need also hospitalization, for surgery, for strokes, for whatever, for cancer treatment and so on. So this has an impact on many, many aspects far beyond COVID-19. And in addition, let's not forget that COVID is not just about having either some kind of flu, a cold, or end up in in intensive care. More and more people are now suffering from what's called long COVID, from long-term consequences. And I know what I'm talking about. I had it myself, and for months I was completely exhausted, and you have cardiac involvement and so on and so on. So it is something that is going to be with us for quite a while. Now, where are we going? And as I mentioned, we're really, frankly, and it's sobering, at the beginning of this epidemic, which, let's not forget, nobody had heard of. It didn't exist at the beginning of the year. It's hard to imagine that there was a world before, but it's true. And in reality, there's only one virus that infects us humans that has been eradicated, and that is smallpox. That's all. And with polio, we're quite, we're quite close. But the good news is that every country has demonstrated in the spring that it can suppress the spread of this virus by the lockdowns and other measures. So that's really important. And secondly, we've learned a lot. We've learned a lot. One of the most important lessons was actually that we must act fast. We should not waste our time. And we should certainly not wait until people start dying in great numbers, because that follows about 3-4 weeks after there is a surge and increase in new infections. So, and that is for sure just as night follows day. We need to act when the number of cases is increasing, not when people are dying. But, the resurgence that we're seeing now after the initial successes over the summer shows how fragile these gains are. If we kind of relax too much the measures that are basically about behavior, then we're paying a high price. And that's what is the risk that we are having now. And also we've learned that there are no silver bullets. I wish there were, just one thing, and then no. It is really, as the President said, an ensemble of measures, but it only works if everybody applies them. If only a minority of people, for example, wears a mask, and it's the average in the European Union is about 60%, that doesn't have that much impact, and long. We need to go to about 95%. That's what they do in Singapore, for example. And that could save hundreds of thousands of lives if we all do it. The third point I'd like to make here for the future is that it's not about public health or the economy, or versus the economy. A recent analysis that was published in the Financial Times clearly showed that those countries that have the highest mortality and had the biggest problem with COVID, they also have the highest economic damage measured as a decline in GDP. So we really need to fix the health issue in order to make sure that the economy can restart and can thrive. And lastly, one issue that I'm concerned about, that also the President mentioned, is corona and COVID fatigue, which I fully understand. It's a big difference when you say, okay, we're going to be in lockdown for a month or so, or 2 months, and then after that everything will be fine. But I'm afraid that that's not the case. We are now talking about much longer efforts. And so involving people, the citizens, is really key. Now, how do we get out of this? And theoretically, there are 4 options that I can think of. One is that by some miracle, the virus changes and becomes innocuous, less infectious and less fatal. Unlikely to happen, but you never know, and the virus doesn't mutate that much, fortunately. Secondly, there is a lot of talk about so-called herd immunity. In other words, people say, okay, let's people get infected, particularly the young, because they die less, and then the virus will no longer have people to infect. Unfortunately, first of all, let's not forget that in Europe, even in the most affected cities, for example, well over 85% of people are still susceptible. So it takes a long time before we go to a level of about 60, 70% that will be needed to protect everybody. But also, let's not forget that the the toll in deaths will be enormous. Millions of people will die. And I think in our 21st century, that's not something that we can ethically accept. A third option is that we go into lockdowns for a long, long time. But that would all push us into poverty. So we need to really have measured approaches. And lastly, and that's where there's light at the end of the tunnel, and that is a vaccine, or vaccines, as we heard from President von der Leyen. And, there are lots of vaccines in development, unprecedented scientific effort about anybody in the vaccine field is doing everything they can to develop a vaccine. 11 are in clinical trials. And I'm quite hopeful that by the end of the year, we will know at least how effective some of these vaccines will be. And the Commission has done a fantastic job, I would say, in terms of ensuring that, by agreements with companies that are developing these vaccines, that every citizen will have access, potential access to vaccines. There will be enough for everybody. However, we still need to go through the process of making sure that we have effective and safe vaccines. And no shortcuts, as President von der Leyen said. So that means, first of all, we need to demonstrate that they protect, and that requires clinical trials that involve 30, 60 to 100,000 people. And we need to make sure that they protect everybody, including the elderly, who are the most vulnerable to die. That's the first thing. And we don't know how long the immunity will last. 1 year, 5 years, lifelong, we don't know. Secondly, safety. Absolutely no compromise there. And so very careful follow-up of everybody who is enrolled in the studies, but also afterwards, when the vaccines are on the market, we'll need to make sure that we carefully monitor vaccines. And that, again, is best done through in a centralized way. Each country does it, of course, but then that we know at the European level, that we know immediately when there are problems so that we can act. And then there is also the fact that we need enough of these vaccines. Again, for Europe, hundreds of millions, for the world, billions. And so there's a concerted effort of industry, of the public sector, to make sure that enough doses will be produced. But that's not only the vaccine, but also think of it, hundreds of millions of glass vials, of syringes, and just name it. And then there's the distribution. As the President said, we need to put in place now systems so that citizens can be vaccinated. And that is a logistic challenge, but some countries have very good vaccination programs. We can build on that, but it will be good to test it out and a European test day to make sure that we learn where all the issues are, the hurdles are. And finally, will people accept the vaccine? And here I'm very worried because recent data from surveys show that up to 25% of people say, I will not take that vaccine. I don't trust it. And so we need to make sure, of course, that the vaccines are safe and effective, but also do a big job in terms of communication. And finally, I believe that the Commission has really stepped up to the challenge quite early on. We heard it from President von der Leyen, and it goes from procurement from tests to protective equipment, but also now the guaranteed access to vaccines that are going to come, but also in terms of harmonizing how various member states are dealing with this, particularly when it comes to cross-border issues. And I agree that sharing data, sharing information is going to be critical. And for me, it really illustrates the value added of Europe and of a European action, because let's not have any illusion. This is not going to be over until it's over everywhere. So that is really important. And at the same time, we need to prepare for the long term, strengthen institutions in each country at the European level, from the European Centre for Disease Control, European Medicines Agency, but also making sure there is a mechanism to support and accelerate innovation and research for the next pandemic and for the next generation of vaccines. So to conclude, it's very serious, but the future of this epidemic is in our hands. And we can do it. It depends on action at the national level. Leadership is extremely important in this kind of issue that affects the whole of society. But in each community, in each business, in each religious entity, and each individual. This is an issue where by protecting ourselves, we also protect the whole community. And I can't think of something that is more of a win-win, to say it that way. And so a long way to go, but I think that it depends really on the actions that we are taking now, whether we will make Europe safe again from this epidemic. Thank you very much for listening.
Thank you very much, Professor Piot. We are now going to move to the Q&A session. I would ask our colleagues from the media only to keep their hand raised in the system if your question is on today's health package that we are presenting. Secondly, I would ask you to please identify yourself and the media you work for when asking your question. And thirdly, to identify clearly whom you are addressing your question to. And we start with Thomas Gutscher. Thomas, you have the floor.
Thomas Gutscher von der Frankfurter Allgemeinen Zeitung. Eine Frage an die Kommissionspräsidentin, genau genommen zwei Fragen. Zum einen, welches soll nach Ihrer Vorstellung die Rolle der Kommission sein, wenn es darum geht, so ein Passenger Locator Form europaweit durchzusetzen? Geht es da nur um den Text und dann wendet jeder Staat das für sich an, so wie es das in Belgien schon gibt? Oder erwägen Sie, Daten auch zentral zu speichern und das quasi als Dienstleistung für die Mitgliedstaaten zu übernehmen? Erste Frage. Zweite Frage. Es ist absehbar, dass immer mehr Staaten in den nächsten Wochen Hilfe von ihren Nachbarstaaten brauchen, was die Unterbringung auf Intensivstationen angeht. Ist das ein Feld, wo die Kommission eine stärkere koordinierende Rolle übernehmen kann? Bisher sind das ja Absprachen ausschließlich zwischen Nachbarstaaten. Vielen Dank.
Ja, vielen Dank. Das Passenger Locator Form wird entwickelt, jetzt in enger Zusammenarbeit mit den unterschiedlichen Institutionen, aber auch mit den Vorstellungen der Mitgliedstaaten, sodass wir eine einheitliche Herangehensweise haben. Und wir werden diese dann auch auf der digitalen Spur vorschlagen, damit wir eben nicht so ein Patchwork haben, wie wir es oft sehen, wenn die Mitgliedstaaten alleine voranschreiten, sondern dass wir eine gemeinsame Herangehensweise und damit auch eine gemeinsame Form haben. Was die Auslastung der Intensivbetten angeht, hier ist es uns sehr wichtig, und das werde ich morgen auch mit den Staats- und Regierungschefs besprechen, dass wir hier Daten auf europäischer Ebene haben, die Transparenz schaffen für alle in Europa, damit wir bei zunehmendem potenziellen Druck auch besser planen können und besser die Kommunikation zwischen den einzelnen Mitgliedstaaten verbessern können. Nämlich dass zum Beispiel die Verlegung von Patienten von einer Intensivstation zu einer anderen, wo die Kapazitäten noch vorhanden sind, dann auch schnell und reibungslos ermöglicht wird. Wir haben ja alle in dieser Krise gelernt, dass der reine nationale Blick sehr schnell an seine Grenzen gerät und dass es uns enorm stark macht, wenn wir als 27 europäisch gemeinsam handeln. Und dieses Teilen von Daten, also der Austausch von Informationen, die Transparenz, zieht sich durch jedes Feld, was wir heute bisher in der Pressekonferenz besprochen haben, durch. Und insbesondere jetzt auch in der kritischen Phase, wenn der Druck auf die Intensivstationen wieder steigen wird, ist es gut zu wissen, wie sind die Kapazitäten, wer ist bereit, Patientinnen und Patienten aufzunehmen, wie können wir den Transport organisieren. Da übrigens kann die Europäische Union durch rescEU auch helfen. Wir haben dort bereits ein System, sodass wir den Transport von Patientinnen und Patienten von einer Intensivstation zur anderen auch über Grenzen hinweg mitbegleiten können.
Vielen Dank. I pass the floor now to David Carreta. David.
Oui, merci. David Carretta, Radio Radicale et Radio Italienne. J'aurais deux questions pour Madame la Présidente. C'est dommage de pouvoir pas vous interroger sur beaucoup de questions parce que la vie continue en Europe malgré le coronavirus. Mais en restant sur les sujets de cette conférence de presse, ma première question, le 2 mars, quand vous avez présenté le Team Corona, vous avez dit que vous étiez très satisfait par la coopération des États membres. Et après, vous avez fait beaucoup de choses comme Commission européenne, proposé beaucoup de choses, mais chaque fois, vous avez été pas bien écouté par les États membres. Et d'ailleurs, aujourd'hui, le premier point de votre communication, c'est la condivision d'informations, donc la base. En juillet, vous avez demandé des stress tests pour prévenir un deuxième lockdown. Il n'y a pas eu les stress tests et il y aura un deuxième lockdown. Donc, est-ce que vous êtes satisfait aujourd'hui par les États membres? Quand est-ce que vous allez dire quel État membre fait bien son travail ou pas? Deuxième question, c'est à propos des conséquences économiques de tout cela. Est-ce que vous êtes prêt à proposer d'augmenter les montants du Recovery Plan ou les règles du Recovery Plan pour faire en sorte qu'il y a plus d'aide pour les États membres? Merci.
So, first of all, this is a process where all of us have learned a lot, and indeed we have asked in many different circumstances member states to coordinate better and to inform. But if we look how far we have gotten, how many systems we have in place now, and I was referring to them initially, then we have increased a lot in the quality of cooperation and in the speed of cooperation. Look at the joint procurement programs, look at the different plans we have, whether it's the testing strategy or the vaccination strategy, but also the preparedness strategy from the 15th of July. So all in this are valuable information for the member states. We have systems in place like the color code that would not have been possible if we would not have joined forces. And the same goes for the vaccine itself. So the advanced purchase agreements we have now with pharmaceutical companies in Europe would not have been possible if we would not have acted as 27 with tasking the European Commission to negotiate these advanced purchase agreements. And here, for example, is, I think, for you as information important and good to know that we have now, if we look at the numbers that are potentially as vaccine doses for the citizens of Europe, in best case scenarios, we could see monthly deliveries of about 20 to 15 million doses of vaccines. The moment the first companies start to signal that they are on the road, the big numbers of supplies are due to start in April. So we have been building a portfolio of vaccine candidates. This would not have been possible if the European Union would not have been standing there united as demanding towards the pharmaceutical companies to comply with us and to come to a final contract. If we look at the best case scenario with all the different candidates, vaccine candidates we have, then we would have over the course of the 2021 about 1.2 billion doses of vaccines. Of course, we know that not every candidate will be a success. So this is the extreme best case scenario number, but it shows that there is a precautionary wide range of access to the vaccines we have here for the European citizen, and not only for the European citizen, but also for low and middle income countries. This is the topic of the COVAX facility. In the best case scenario, so different vaccines are successful in our portfolio. We could vaccinate 700 million people. This is more than necessary in the European Union. Would include also our donations to low and middle income countries. I am very much opposed to a blame game, who does it well and who doesn't do so well. Because in this pandemic, what we see, we're all learning to deal with the virus, and the whole world is learning to deal with the virus. We have gotten better. The numbers, for example, that we've shown at the very beginning show that, for example, in the treatment, for example, in mainly the treatment in hospitals, we have improved. We have made experiences, and the medical doctors and the caring personnel knows better how to deal with that. But in a situation where there's a lot of learning ahead of us, I'm a strong opposing to blame the one and to praise the other. It's a mixture of many different actions that have to be put together in order to be successful in fighting this virus and learning to live with this virus till we have sufficient, effective and safe vaccine. The recovery plan, 750 billion. We have right now started with the SURE package, 100 billion. The first tranches have been decided yesterday. For Spain, for example, for Italy and for Poland, other member states are having access to the first tranches too. So this will help at the moment. But then we have ahead of us 750 billion of Next Generation EU, where we have the duty to invest it in a way that it will help to recover, but also build our resilience in the European Green Deal, in the digitalization. So there's a huge package ahead of us, and I think we should first of all deal with that before we talk about other options.
Thank you very much. I now pass the floor. Je passe la parole à Christian Spielmann. Christian, est-ce que tu nous entends?
Madame von der Leyen et Monsieur Piot, s'il vous plaît, les États membres vont prendre dans les jours qui viennent des mesures encore plus drastiques que celles qui ont été prises aujourd'hui, et on a vu qu'ils ont tous agi encore une fois en ordre dispersé. La Belgique en est l'exemple le plus flagrant. Je voudrais comprendre ce que vous venez de nous dire. À la fin de l'année, on saura si on a un vaccin et s'il est efficace. Est-ce que ça veut dire que vous nous prédisez que ces mesures drastiques qui ont suscité beaucoup de fatigue vont durer au moins jusqu'à la fin de l'année, qu'il n'y aura pas de trêve et que les fêtes de Noël vont se passer à peu près tous enfermés chez nous, peu de contacts, peu de fêtes, rien, pas de marché de Noël? Est-ce que c'est ça ce que vous nous annoncez? Et comment est-ce que vous pensez que les citoyens européens vont réagir à une telle annonce qui n'a absolument pas été préparée en amont? Donc c'est-à-dire qu'on va leur annoncer ça aujourd'hui ou demain, au mieux avec les dirigeants qui vont harmoniser les mesures qu'ils vont prendre. Et ma deuxième question, qui est toujours, là c'est plus pour vous, Madame la Présidente, vous avez dit on s'est mieux préparé. Moi je veux bien qu'on dise qu'on s'est mieux préparé, mais comment m'expliquez-vous que les hôpitaux de l'Union européenne aujourd'hui, alors qu'on n'est pas au plein de la deuxième vague, soient déjà sursaturés, n'arrivent pas à accueillir, et que les personnels soignants soient au bord de la dépression nerveuse, que beaucoup n'ont pas regagné les postes et qu'on est obligé d'aller prendre des gens qui viennent du privé pour venir assister, prêter main forte? Comment se fait-il qu'on n'ait pas, entre la première et la deuxième vague, on n'ait pas préparé les hôpitaux à affronter cela? On a applaudi les personnels soignants lors de la première vague, on ne leur a pas donné ni les moyens, ni financiers, ni humains pour pouvoir affronter la deuxième vague. Et ça, j'arrive pas à le comprendre. Je sais que c'est des politiques qui sont du niveau national, mais la Commission est chargée de coordonner tout ça. À qui est la faute? Je sais que vous n'aimez pas le blame game, mais c'est quand même très très important à comprendre. Merci.
So, what the timing with the vaccines is concerned, I think it is important to go a little bit in depth, and afterwards, Peter, I would appreciate if you compliment. So at a certain point in time, the first pharmaceutical company will be there with a vaccine that then goes through the necessary clinical trials. And it might be till the end of the year that one of the pharmaceutical companies is able to go into that stage. But it will take time, and this is important to communicate that early enough, till a vaccine is tested in a way that we say it's effective and safe. And with effective, I mean it creates immunity to a certain degree. Not every vaccine creates 100% immunity, but it may be that it's a 70% immunity, it's maybe even less. This is so with the first generation of vaccines. And this shows that a diverse portfolio of different vaccines that are in the short run in different stages is and was so important for us as European Union to secure. In other words, the vaccine is not the miraculous event that changes all from one day to the next. It is the light at the end of the tunnel, but it takes several steps before we see full light at the end of the tunnel. And apart from the vaccine question, I think that this year's Christmas will be a different Christmas. A lot depends on our behavior from the individual, each individual on the regional level, on the member state level, and on the European level, how we pull through this together in the next weeks. But it will be a different Christmas. What your questions on the hospitals is concerned, most member states took the experience from the first wave and prepared better during summer. The production, for example, of ventilators has drastically increased, but true is too that the healthcare workers are exhausted. They are in this since March. And yes, it is a very, very difficult situation. And therefore, the more important is that we share the data on the situation in the healthcare sector and mainly in the ICU, so that we have together transparency and an overview on the European level in order to act and react in a coordinated way. And you hear from my words that the whole journey in this pandemic has been that we learned together. We were always stronger when we did it coordinated on a European level. There are many, many topics where we have successes, but we know this is a long fight. We're in that for a long haul, and therefore we have to keep spirits up in vigilance, in compliance, and of course in the coordinated action we have.
Professor Piotr.
Oui, merci.
You have the floor.
Bon, je voudrais d'abord, Monsieur Spillmann, merci pour votre question. La question de la durée de ce confinement, où c'est pas exactement le même genre de confinement, pratiquement tous les pays essayent de, par exemple, de continuer à laisser les écoles ouvertes donc c'est un peu différent quand même. Mais est-ce qu'il y aura une trêve? Tout dépendra de l'efficacité des mesures qui sont mises en place maintenant, comme l'a dit Madame la Présidente. Et je ne connais pas les plans des pays individuels, mais il est clair que si les mesures qu'on est en train de mettre en place et qui ont déjà été mises en place avant marchent, qu'il y a peut-être, mais on ne sait pas, une occasion de relaxer un peu. Mais une des leçons les plus importantes de l'été, c'est que si on relâche trop, on va vers une troisième vague. et avec peut-être encore plus de morts. Donc pour moi, pour revenir à votre question de Noël, ce sera une occasion de peut-être de développer un Noël de solidarité qui sera un peu différent que, comme l'a dit Madame la Présidente, mais il est encore un peu trop tôt. Le message le plus important pour moi et comment je vois les choses, c'est que ici, on ne dépend pas des politiques d'un gouvernement. C'est quelque chose qui c'est très important, mais c'est aussi le comportement individuel de chacun qui puisse faire la différence. Mais le vaccin aussi, quand nous avons dit qu'on aura les résultats des essais cliniques, je crois assez bientôt, ça ne veut pas dire que le vaccin sera disponible immédiatement. Et donc, même si le vaccin est là, je crois pendant encore tout un temps, on devra combiner ça avec des mesures, par exemple, porter des masques, des mesures de distancement social et tout ça. Donc, ce ne sera pas comme ça d'un jour à l'autre qu'un retour à la normale. Et sur votre question sur les hôpitaux, je suis d'accord avec vous. C'est le personnel dans certains hôpitaux, certains pays sont vraiment, oui, dans une situation très difficile. Mais au moins maintenant, il y a plus de matériel de protection. On est bien mieux préparé. Et par exemple, on sait maintenant que on va plus envoyer quelqu'un en soins intensifs avec un ventilateur comme on le faisait avant, quand on ne savait pas. Mais il s'agira de vraiment une gestion bien meilleure des ressources humaines, pour le dire ainsi, parce que, comme l'a dit Madame la Présidente, on est là pour quand même encore un bon bout de temps. Merci beaucoup.
Thank you very much. I now pass the floor to Naomi O'Leary. Naomi, you have the floor.
Thank you for taking my question. My question, if possible, is for both President von der Leyen and also Dr. Pio. So my question is, why has the strategy in Europe failed? Thank you.
Naomi, could we ask you to repeat your question? Sorry, we had a little problem at our end.
Certainly, no problem. My question is both for President von der Leyen and Dr. Pio, if possible. It is, why has the strategy in Europe failed? Thank you.
So, this pandemic has hit us in a way that if you look back, you can see that a lot of things were done in the right direction in the first wave, but obviously the exit strategies were partly too fast and measures were relaxed too soon. So that there is a second wave, and we do not know whether this is the last wave, is also a characteristic of a pandemic. It's not the first time that this is visible. So if you look in the history books, you see that this is a classical symptom. And we have been able in the first part of the year to effectively reduce the spread of the virus. But then we see that after the summer, the increase took place again, partly exponentially. So now we can act with the experience of the first half of the year. So we have an advantage in knowledge. We know better what works, and as I said, we are in several fields better prepared. And therefore it is now so important to be stringent, to stay coordinated, to act fast and to act intensive and coherent, Because this is a challenge that the whole world is facing. So we will be in this for quite a while. And therefore, I think a summary judgment is not yet due, but only when we've overcome this crisis.
Professor Piot, do you want to add anything to this?
Yeah, I agree with President von der Leyen. So personally, I think originally we were confronted with something that nobody had ever been confronted with before. Let's not forget that. So we were learning very fast, learning while we were doing, or I always say learning while we were racing. And so I think that worked initially relatively well. But then personally, I probably was too optimistic in terms of how people in general would, continue to respect certain basic rules of social distancing and so masks. And that's where I think in the summer we probably should have done more. As they say in English, that you repair the roof when the sun shines, and that's when probably collectively we should have put more effort in testing and tracing. But the jury is still out. I would say that I agree. I mean, I think we need to look forward now. We need to also appreciate certain things like the enormous stress on people's livelihoods, on people's lives, the mental health issues and so on of these measures. And on the other hand, there is a need to combat this epidemic. And as I mentioned, if we don't get the epidemic under control, there's no way that the economy can revive. So that tension, how to manage that, is unprecedented. But the key now is that we, there's no time to waste, no time to lose to put in place all these measures. The question is for how long? Can we go to a system where you have, let's say, what they called in Singapore like a circuit breaker for a few weeks' time and then have a bit more relaxed and then go back? I mean, the biggest problem for both individuals, but also for companies, for institutions, for governments, is the difficulty in planning. Whether it's planning for, I don't know, your wedding, or planning for, the budget for next year, etc. And so this is something we need to also think. So can we do that in a more way? And I don't have an answer to it. But at the moment, I think this is a strong case for better coordination. That sounds very boring, but in this case, it's essential and can save lives at the European level to harmonize certain approaches and to quickly learn from each other, so that whenever we think that we have a better idea or something doesn't work next door, that we can take measures that are appropriate. And also looking beyond Europe, both in terms of what not to do and what may work. And I'm convinced when you look at like East Asia and Southeast Asia, there's a very strong sense of community, and perhaps that's what we also need to come back to in Europe. I know this sounds like not very measurable, but at the end of the day, this is what it's going to take to defeat this virus, and also to accept the vaccine and to, build a new society again. Over.
Thank you. We now move to Griselda Pastor. Griselda, quick question, please.
Merci beaucoup. Vous m'entendez? J'espère que oui.
Absolument.
Oui.
Ma question courte est pour Madame von der Leyen, ma première question. J'aimerais savoir si demain, Madame la Présidente, vous attendez un compromis, un engagement clair des États membres sur l'utilisation de tests rapides. Et pour Monsieur Piot, j'ai aussi une question, parce que vous faites un appel à la responsabilité individuelle, mais nous avions vu en Chine, par exemple, qu'après 15 nouveaux cas, il y a eu des millions de tests qui ont été faits. Donc j'aimerais savoir, est-ce que le confinement est à ces moments précis la seule alternative dans des États, je ne sais pas, comme en Espagne, en France, en Belgique, en Italie, ou bien un usage de tests est encore possible pour l'empêcher? Merci beaucoup.
So, to answer the first question, the rapid tests are now coming to the market. We have today put forward a testing strategy, and we will work more intensively and come out in a couple of weeks with a more detailed concept what the rapid tests are concerned. The rapid tests have a big advantage. They are fast, they are cheap, and therefore they can fit into a certain hole, because when you get the question, when you get the result is also a crucial one. Of course, the gold standard are the PCR tests, but the rapid antigen tests can complement very well. They are not as reliable as the PCR tests, so because they are not as good as the PCR tests to detect an infection when there are no symptoms and there is a low virus load, but they have their advantages, what speed is concerned and what mass testing is concerned in a population where you have a high level of infection, or in a situation, environment where you have a high level of infection. So it's not only one test. There are different ones. What we also are going to do is evaluate the different tests so that we have a better idea what the quality is of the different ones, and can give this advice to the member states.
Thank you. Je passe maintenant à Philippe. Oh, sorry. Professor Piot, do you want to add something?
Oui, merci beaucoup, Madame Pastor. Oui, quand je dis responsabilité individuelle, ce n'est pas que ça. Je dis que ça nécessite des actions à tous les niveaux, européens et individuels et nationaux. Mais est-ce que le confinement est la seule option? La réponse, ça dépend de l'ampleur de la situation et de la propagation du virus. Si on détecte une bouffée épidémique du virus corona précocement, on peut vraiment limiter le confinement à une localité, ou même, on l'a vu par exemple dans plusieurs pays, des abattoirs, et faire un dépistage, un testing et dépistage, et donc quarantaine assez poussée mais très ciblée. Mais une fois qu'il y a transmission à grande échelle dans la communauté, c'est beaucoup plus difficile. Mais il y a des pays qui peuvent opter pour le dépistage à grande échelle. Mais là, il faut voir aussi à quelle fréquence, toutes les semaines, tous les 3 jours. Ça sont des questions qui restent ouvertes. Et il ne faut pas oublier non plus que ce qui est acceptable en Europe, dans un pays, n'est pas comme la Chine, n'est pas forcément ce qui serait acceptable pour les citoyens ici. Mais je crois qu'un plus grand usage des tests, et comme l'a dit Madame la Présidente, avec les nouveaux tests, ça, à mon avis, ça doit faire partie de ce package. Mais dans beaucoup de pays maintenant, la situation est telle, avec une dissémination du virus dans la communauté, que un degré de confinement est sans doute nécessaire pour supprimer maintenant le virus et sauver des vies. Merci.
Merci beaucoup. Nous avons le temps pour une dernière question et je la passe à Philippe Régnier. Philippe.
Oui, bonjour, Philippe Régnier du journal Le Soir. Je voudrais insister sur cette question des tests rapides. Et c'est une question que je pose à Madame la Présidente et à Monsieur le professeur Piot. Est-ce que, malgré tout, ne fait-on pas aujourd'hui, au moment où plusieurs États membres se reconfinent d'une manière ou d'une autre, ce sont des lockdowns partiels, mais n'empêche très sévères quand même, qui s'annoncent, est-ce qu'on n'acte pas je dirais une sorte d'échec de la stratégie de testing tracing basée sur les tests PCR dont les résultats prennent des jours parfois à obtenir, et que donc maintenant on se dit que pour essayer d'éviter une troisième vague, est-ce qu'il n'est donc pas nécessaire de passer à des tests aux résultats extrêmement rapides, quitte à devoir en faire 2 d'affilée, et donc que ce serait, disons, la nouvelle stratégie de l'Union européenne? Et question subsidiaire, parce que je pense avoir vu ça dans la lettre du président du Conseil européen hier, se pose aussi la question des fournisseurs de ces tests. Est-ce que pour ces tests rapides, on est également complètement pieds et poings liés, je dirais, aux fournisseurs chinois? Merci beaucoup.
So I think what the quality of testing is concerned, this is a classical question for Peter Piot. I think not only one test or one type of test is what takes it all, but they are complementary, and I think Professor Piot is the right one to detail that out. As this is the last question, we've gone through the different measures to fight this virus together as 27 member states, 450 million citizens of Europe, and the difficult task to coordinate every new step that we're learning over time. But I want to emphasize there's another side to the European Union too. And this is where the European Union, the European Commission, has a classical competence compared to the health sector, and that is the single market and the economic side. And I think we also should be aware of the fact that in an unprecedented way, this time, Europe has acted. We flexibilized all structural funds. We triggered the general escape clause. We have now the SURE package in case, and I guess many regions of the world would love it to have such a possibility to support short-time work in a critical stage in healthy companies. And we have Next Generation EU, unprecedented in volume, unprecedented in structure, and it is for the first time that in such a severe crisis, different to 10 or 12 years ago, it is not an intergovernmental solution, but it's a true European solution. So as difficult as times are, here are positive sides that are classical European. It is the European way to do it. And I think we should also keep that in mind.
Professor Piot.
Oui, merci Monsieur Renier. Oui, je crois que dans 6 mois, toutes les stratégies de dépistage, de testing seront assez différentes de ce qu'on utilise aujourd'hui. Vous avez parfaitement raison, ce n'est pas l'acte du test même qui fait la différence, mais c'est la communication rapide et puis l'action en fonction du résultat du test qui compte. Et c'est ça, en fait, dans pas mal de pays, pas mal d'environnements, c'est ça la faiblesse du système. Et c'est pour ça que dans mon esprit, dans ma vision, ces tests devraient être disponibles dans les pharmacies comme les tests de grossesse à un moment donné. Et aussi simple pour que chaque personne puisse le faire, mais il faudra ici un système de dépistage bien plus développé. Parce que quand on compare la première vague au printemps avec ce qu'on vit maintenant, au printemps, quand on voit les statistiques officielles sur les cas détectés, les cas notifiés, il y en avait en fait très peu, mais ça reflétait aussi le fait qu'il n'y avait pas d'accès au dépistage. Donc, il y a quand même une grande amélioration, mais ce n'est pas parfait. Et puis, on est débordé maintenant à cause de la transmission au niveau communautaire. Mais donc, ce sera une combinaison d'une meilleure organisation, d'une meilleure gestion du système, mais aussi d'innovations technologiques qui font qu'il y aura des tests plus rapides, plus fiables, et moins cher, important aussi. Et votre question sur les fournisseurs, la dépendance de l'étranger ou de la Chine, c'est vrai pour des ingrédients de tests, de certains tests, mais pas de tous les tests. Et en Europe, il y a beaucoup de start-up, de petites entreprises qui sont en train de mettre des tests sur le marché. Je crois que là, il y a une opportunité pour développer cette industrie un peu plus au niveau européen. Et je suis tout à fait d'accord avec Madame von der Leyen en disant que ces crises, pour moi, sont toujours aussi une opportunité et en fait une responsabilité pour renforcer le système. Ça, on voit les défauts, toutes les lacunes qu'on a dans nos systèmes. Alors, il faut voir que pour la prochaine crise ou l'année prochaine, on est mieux préparé, on est mieux équipé et on a parlé des vaccins, mais c'est aussi meilleure communication. Et si jamais il fallait, disons, inventer une raison d'être pour l'Union européenne, malheureusement, cette épidémie l'a fournie de façon qui, à mon avis, ne peut pas être disputée par qui que ce soit. Merci beaucoup.
Thank you very much, Professor. Thank you very much, President. This brings us to the end of today's press conference. As I said at the beginning, the President will be back in the press room on the 1st of December. So for many of you who unfortunately did not have the opportunity of asking a question today, there is another opportunity in a short time. Thank you very much. Have a nice afternoon.